Hello everyone, myself Mohit Kumar and I'm from block 1B. I'm going to demonstrate you how to do the otoscopy. So first of all, before doing any examination on our patient, we have to make sure that we have taken the proper consent from the patient. We have taken the proper history from the patient as well. So let me start with the otoscopy. Hi ma'am, myself Mohit Kumar. Can I know your name and age please?
Myself, Preeti Dubey, and I'm 25 years old.
Alright, do you have any problem with your ears?
No.
All right. So I'm gonna just look inside your ear. So with the help of the otoscope, is it fine with you?
Yes.
All right. So while we are doing the otoscopy of the right ear, we have to make sure that we're gonna hold the otoscope like a pen, and we have to make sure that we are holding the otoscope in our right hand while doing the right ear examination. Okay. Now for the better view of the ear canal and the eardrum, what we're gonna do? We're gonna pull our patient's ear upward, outward, and backward. So to straight the ear canal and have a good look of tympanic membrane. We have to observe is there any kind of the perforation or any kind of the color change in the tympanic membrane or exudation, anything, whatever we think that it's abnormal, we have to observe everything. So that's it. Likewise, we have to do for the left ear as well.
Hello everyone, my name is Neeraj Singh. I am from block 1B and today we are going to perform the otoscopy examination. So first of all we have to take the proper consent. So let's start the examination. Hello sir, my name is Dr. Neeraj Singh. Can I know your name and age please?
I have myself it is my age is 23.
So today I am going to perform the otoscopy examination with the help of this otoscope. Are you okay with it?
Yeah, okay.
Okay. So when we do the otoscope examination, we have to hold the otoscope like a pen, and if you are performing in the left ear, so you have to hold it with the left hand. Okay. While doing the examination, to have a clear view of the tympanic membrane, we have to move the ear upward, backward, and forward, and so we can have the clear view, and we have to observe any abnormality in the tympanic membrane. Thank you.
What is your name?
Shruti.
Okay, so today I am going to perform a tuning fork test which is useful to assess a hearing loss. So I am going to use this 512 Hz tuning fork. First I am going to perform a Weber test. In this test I will tap this tuning fork and I place this tuning fork just mid of your head. Okay, so you have to tell me whether you heard the sound louder in your left ear, right ear or equal. Okay.
Equal.
Okay, so now I am going to perform Rainy test, which is useful for air conduction and bone conduction. So first, I will tap this tuning fork, and for bone conduction, I will place this tuning fork just behind your ear on the mastoid bone. Okay, this one I will call position 1, and for air conduction, I will put this tuning fork just perpendicular to your ear, and this one is position 2. You have to tell me whether you heard sound louder in position 1 or position 2. Okay. Position 2. Position.
My name is Kuldeep. I'm going to perform a internal examination of the nose. Now I'm going to perform on this patient. Then we can hold the tip of the nose. Then we can see that in the nose there is any ulcers, any vestibules, any scars. While we using the otoscope, there is no scars, no vestibules, and no ulcer. The patient will be okay. Thank you.
First, introduce yourself to the patient and then start by asking the patient to open their mouth widely. Begin the examination by inspecting the oral cavity. Observe the upper and the lower teeth as well as the buccal cells on the each side. While the patient tongue is at rest, inspect the upper and the lower teeth and examine the buccal mucus on the both sides. Next, ask the patient to stick out the tongue to the one side. This allows you to inspect the lateral part of the tongue of any abnormalities or tumor. Switch to the other side and examine the opposite lateral part of the tongue. Afterwards, ask the patient to retract the tongue and touch in the roof of the mouth. Depress the tongue gently using the tongue depressor. It will help you to visualize the hard and soft palate as well as the posterior pharyngeal wall. Here you can also palpate the parotid gland to ask the patient to close the mouth while feeling the gland. If needed, express saliva through the parotid duct, opening the access its function. This concludes the comprehensive exam of the mouth and oral cavity.
We will proceed to physical examination of the neck, looking for symmetry, range of motion, and lymph nodes. Start with preocular lymph node, cochlear lymph node, then cervical lymph nodes. Then check the thyroid for any symmetry and palpate it. Proceed to check supraclavicular lymph nodes and then ask the patient to sip a glass of water to check alignment of thyroid and nearby the area.